So, hello and welcome to the first in-person edition of the Hooked on Health podcast featuring myself, Dr. Sean. And today I've got Dr. Marisa with me today. She's a staff physical therapist here at Concierge PT, a marathoner, and an expert in all things running. So, Marisa has both a doctorate in physical therapy and a certification in athletic training from Springfield University College, Springfield College, and is just an expert with all things athletic, and has recently run the Disney Marathon.
I did this
Uh,
past January.
So super excited to have her on board today and to talk about all things running. So we're in the midst of a snowstorm here in February, and we got the Boston Marathon coming up
We do.
in really about 2 months. So we wanted to just chat a little bit today about, some of the common conditions that we treat in runners. And just kind of go through what stretches you can be doing to hopefully prevent some of these conditions, what exercises Marisa does daily as a physical therapist to prevent pain in our lower extremities and, potentially upper extremities too, because it's the body's all tied
Yeah.
together. And some other cool things. So without further ado, Dr. Marisa.
So I started my running journey when I was back in college. It was on my bucket list to hit a half marathon, and it has just gone up from there. So this past year, 2023, pretty much spent the entire year training up for the Disney Marathon in January. So it's been an exciting journey for me. I actually got to be a Boston Marathon volunteer this past year, and will be this coming year as well. And then got to run their other races. I did their Boston medley this past year. So I ran their 5K, 10K, and half marathon. And it was a perfect lead up and kind of a perfect timing to train for the Disney Marathon.
That's awesome. So Marissa's an avid runner, like we discussed, and she also treats a lot of runners. So what would you say the most common conditions that you treat in a running population?
I'd say a lot have seen recently are just kind of like overuse of a lot of them, like a cross country runner. They have specific deadlines of when they have to have so many miles and they're preparing for the season. And sometimes they just can't stop running to keep those miles up. So a lot of just like calf pain, a lot of times that medial tibial stress syndrome or shin splints, as a lot of us refer to it as. And then just pulls here and there, like either pulling their hamstrings, pulling their quads. Different things of they've just been pushing their bodies to those extreme limits, and just have to find a way to kind of back off but keep their training going.
Talk about the importance of having a training regime.
Yeah, so that was a big thing, and everyone's going to be different. You're going to find 1,000 different training plans out on the internet, and the big thing is finding what best works for you and getting that schedule down. So our training up through the half marathon was we were looking at like 3 times a week for running. And then for the marathon, we thought, oh, we have to bump up our miles. We have to run 4 times a week. And then we learned that that became too much on our bodies and it just wasn't the right fit for us. And we were actually pushing ourselves more into that injury side of things than really helping our training. So we backed off and went to three times a week, and clearly it worked as we're able to complete the marathon. But it's all finding what's best for you. Some people are solely like, we're just going to run the whole thing. Some are going to work on like, hey, we're going to do some easy runs, some tempo runs, and some people walk run. And it really doesn't matter what your strategy is, because at the end of the day, all of us have the goal of finishing. So it's really finding what's best for you.
Yeah, and I was listening to maybe some other podcast the other day, and it might have been like Jay Shetty or something like on the Daily Com, but he talked about what your specific goal is and kind of like two different types of goal setting. So I think
Yeah.
that's really important that you bring that up because some people their goal is just to finish the marathon.
Yeah.
And some people like their goal is just get a little bit better every day,
Yeah.
right? So, I think that yes, it's important to, start with a really firm goal in mind. And, if the goal is to finish the marathon, I think that's, really awesome. But I also think it's important to just focus on getting a little bit better every day, and I
Yeah.
think kind of striving to just, if you stick to a plan, it's not going to happen overnight. So just like get a
No.
little bit better over every day. And then like, your body's going to change and, your cells adapt and, your muscle, there's research that shows that, the different types of your muscle fibers can actually shift such that some that were anaerobic and mostly for power, power exercises actually can shift to aerobic, which is kind of unique. We've also got fibers in the middle that are X fibers that are able to shift. So you can literally train yourself into being a runner. So I think
Yeah.
that's pretty
The
cool.
big thing is just enjoying it. And because I hated running in high school, truly was not a fan of it. And then it was a bucket list thing. And here I am. It's something that I really enjoy doing. And even without a race to train for, like out there running, just because it's something I enjoy doing.
Yeah. Is the runner's high real?
My personal experience, yes. I would say other people disagree with that. I very much a couple miles in kind of forget what I'm doing and you just keep going. And then all of a sudden you look down at your watch and it says you're 10 miles in and you're like, okay, this is cool. Like, but I think it exists. Other people may disagree, but
Yeah, I love that. I always ask every runner that. What are the best stretches that you recommend to your patients and really to anybody in the street for running?
feel like it's just finding like a good warm up and doing what's best for you. Like if you're someone who's like super tight in the hamstrings, definitely focusing on the hamstrings, but also moving through your low back, your mid back, just kind of getting a full body stretch in and making sure that you're like consistent with it is really the big thing. Like I have a pro stretch at home, so definitely stretching the calves. I know I'm tight there. Just kind of doing what is super tight on you and what's going to feel good, but not like overdoing it before a run.
If you were to pick one stretch above any other, which one would it be and why?
I would personally pick a calf stretch, but that's normally what I feel like super tight on. And what really like my calves or what I feel the most like in a run before anything else. Like marathon wise, my hamstring started to hurt, but definitely normally like my calves kind of are what I feel first on a run.
Yeah, and research tends to support that when they look at, meta-analysis for chronic knee pain. One, intervention that does very well across the board is just simply stretching your calves, and my idea, my thought behind that is that it crosses multiple joints,
Yeah.
right? So, really it starts at your ankle, but it's kind of tied into your plantar fascia a little bit too, as part of that fascial sling or one kind of connective tissue
Yeah.
piece. And then it attaches above your knee. So if you're tight anywhere, it's, that calf is,
You're
typically
gonna
a
feel
place where a
that.
lot of
Yeah.
that rests. And another muscle we just talked about that, it's really a muscle quality thing. You could have full dorsiflexion,
Yeah.
meaning that you can bring your toes up all the way 10 degrees or 12 degrees, but like the calves are just tight.
Yeah. The
Uh,
quality, like you're not getting that full movement there. And it's just like, it's not a pretty movement. Like it might be a little jerky. So getting that good quality movement's really important.
yeah, that's awesome. What are some of the exercises that you do daily when training for a marathon?
Tried to get some bridges in there. I was a big like muscle activation. So I squat, I would do some like RDLs before like going on a run, just anything to kind of get everything warmed up and going before. Um, just like heel raises to get the calves going. It's kind of anything to work individual muscles to make sure they're turning on for that run.
Yeah. How about off days? So like training days, what would you do for and like a workout routine?
So it was like at home workouts, like actually following like a runner's program of just like easy, like strengthening, like not going heavy, but still getting some squats in there, doing like a quad focused day and then more of like a glute hamstring focused day. Just trying to keep the body moving and getting some upper body in there as well. Because you don't think about that as much when you're running, but it's definitely a component of just your posture to be able to run, and you just want to have a full body strength.
Yeah, and also you're, working in lateral chain motion, right? So like doing the like sidewalks, as simple
Yeah.
as they sound, or lateral leg lifts. It doesn't take much time, but the bang for the buck is especially in a female, right, where your hips are wider and what we call a Q angle, where the angle of the hips is a little wider than the angle of the knee as you go down to the ground. You really need strong glute meads to
Yeah.
make sure that you're protecting the inside of your knees from breakdown, from cartilage breakdown. Um, but that's great. Um, Nutrition, fueling.
Yes.
So let's talk about that.
So that was something I would say in the last 2 years I focused a little bit more on. My first two half marathons just went for it. I don't even think I carried water. I just relied on like the water stations. But recently kind of dove into like what do you need to be able to continue to run and not hit that wall. So me personally, my fueling plan was every 3 miles. It was just easy enough of kind of no matter the time, it was like every 3 miles taking in some sort of fuel. At times it wasn't Uncrustable, and other times it was like running gels or the sports jelly beans, like anything that could easily get down. Because they say you should have about 30 to 60 grams of carbs every 45 minutes to an hour for that first 2 to 3 hours of running. And then after that, you need 60 to 90 grams of carbs every hour, which is a lot to take down.
Yeah.
So it did eventually switch to like a carb drink mix, which I realized that's a lot easier to get like 50 grams of carbs down.
It's like a Gatorade type.
So it was Scratch was the brand. They make like a high carb mix, so you can have almost 100 carbs in 16 ounces of water.
Nice.
It was just easier to get down because 4 or 5 gels in, your stomach starts to feel it. So I definitely recommend practicing your fuel on your long runs. Race day is not a day for anything new, whether it's fueling or shoes. Like race day is not the day to try it. But it's definitely figuring out what works for you. Some people can go a lot longer without fueling. But I definitely would say that wall at 20 miles was not as much of a wall just because of fueling throughout.
Nice. When do you feel as though it's time to see a PT?
When you're just pushing through an injury and it's been about a month, even sooner. Like if it's really stopping you from running, you should see a PT sooner, because most likely there's more than just whatever hurts is going on. Like if it's your calf that's hurting, you probably have something going on at your knee and your hip that the PT can definitely start to work on. But when it starts to like hurt your training plan, when you're like, I'm not getting my miles in, I'm not progressing as I want to, something just feels off. Like there's definitely soreness, like here and there I've had, like my posterior tib has hurt, like my knee has hurt. But when it kind of goes away after a run or two, I'm like, okay, like it was just an off day. But when it's been persistent like that and you're realizing that you're just not performing as you want, definitely contact a PT.
Yeah, and I think, my rule is like 3 to 4 days. I think if you're, you still have the same sharp pain after 3 to 4 days, or it's not going away, or it's been in the same spot for a month and it's just like kind of taking a little bit longer to go away. Um, just call a PT and get checked out. So it kind of leads well into like, I'd love for you to talk about like, what do we do at PT when somebody comes in?
So a lot of times it's looking at specifically, okay, what hurts that you're coming in for, but I'm not just going to look at your ankle if that's where your pain is. We're going to look at your knee. We're going to look at your hip, look at your mobility. Like what does your range of motion look like? Can you touch your toes? Can your ankle move through that dorsiflexion that we should see? But then we're also going to look at your strength. And a lot of times runners have like decent table strength. Like they have some strength there, but I'm also going to look at like what's your squat look like? A lot of running is single leg like activity. So what does your single leg squat look like? What does your balance look like? Can you stand on that one leg before your hip drops? Like, can you actually hold that? Because if you can't stand for 10 seconds without that hip dropping, that's what's happening every time you run. So it's kind of looking at more like this dynamic picture of how are you moving? And then what are we going to do to fix those movements to improve your quality of movement?
Yeah, so I think we touched on the strength piece and kind of finding which muscle groups are strong and which muscle groups are weak. I'm sure we'll look at how you walk, probably how you run if you can run. What that pattern looks like. That gives us some information. But definitely too, I think one of the most crucial things to look at, and it's tough to like objectively measure, but it's the muscle quality, right? So
Yeah.
like we're gonna look at your muscle length, like are your calves tight, or your hamstrings tight, or your quads tight. But like sometimes if you just go to like any Joe PT, which is great, they may look at your quads or your hamstrings and say, oh well, like your hamstring 90/90, which is a test that we do to test muscle length, it looks great, right? But like we're not just going to stop there, right? Like we're going to look and make sure that we're treating those hamstrings, because when you put your hands on them and they feel like piano strings, like we want to make sure that we're using our hands and getting in there and improving muscle quality and muscle length too, because
Yeah.
those chances are they're still pretty tight.
Yeah. And even like it seemed good, but like there's always improvement that you can make in that muscle length and the muscle quality.
Yeah, and I think other things that, I'd love for you to talk about, like shockwave and dry needling and other things that we can do for runners that, may not be run of the mill. Had to throw that in there.
Definitely, there's a lot of tools out there, and definitely the dry needling and the shockwave. If you have like the PT finds that poor muscle quality, like we're gonna work on that. Like if you're super tight or your plantar fascia has been tight for months and nothing has worked, I've personally seen how the shockwave, um, it just the pain goes away. Like they're able to walk again without having that constant pain in the morning, pulling on there, as well as just like the tightness throughout. Dry needling is great at getting into that muscle quality, allowing the muscle itself to relax, like to clear out that neuromuscular junction. So you're not constantly just gripping on and holding tight. You can actually relax and move through that entire length that should be there and that is there, but you're just not moving and using what you have available.
Yeah, and I think that's just such a good point because once you get that range of motion, then we need to strengthen into that range of motion, right? So, if your muscles are constantly here and then we give you that new range, you have to strengthen so your brain
Yeah.
body can confirm that, right? Because otherwise it just goes right back to here. And that's why, PT can fail and has failed, probably in the past for some of the folks that are listening to this conversation because you have to be consistent with it. So let's talk about like frequency and duration. Like how often, how long do you typically see your runners for?
Kind of depends on what their goal is. A lot of times runners are coming when they're in their training season and their training block. So you want to keep them going, but at least twice a week to start. You got to get them in, you got to get them moving. And you're probably going to be here for a while. You truly need at least 8 to 10 weeks to strengthen, but we got to make that new muscle length first. So everyone thinks like, oh, 8 to 10 weeks to strengthen, I'll be good after that. But we got to get that new muscle length first. So you're probably going to look at like 12 weeks of PT of you got to be good at the home program and just work on that strengthening. But PT can definitely help.
Yeah, and I think it's just, it's a commitment just like running a marathon, and I think you get out of it what you put into it,
Yes.
and I think, you know, I like to do, a little different style. So I like to do kind of a tapered plan of care. So, I like to start at like 3 times a week for a couple weeks and then twice a week and then once a week. And I think, they're both equal, like the same strategy, very similar strategies, but, I think that it's important to as PTs, we give our patients the success, the
Yeah.
tools for success. We do as much as we can with our hands and with our knowledge to give you, the exercise and update your exercise plan and all that. But I think a lot of it just depends on where they are in like the
Yeah.
training. Like if it's 2 weeks before the marathon, you might be in every day, to make
Yeah.
sure that we've got you, you're in a good place. If it's 3 months before the marathon, or like right now we're 2 months before Boston, it might be like, hey, let's get you in the next couple of weeks. We're going to get this, like really try to heal this up for you. And then we're just going to kind of follow up as needed with you and
Yeah.
give you the tools and the strategies to succeed.
Definitely like we're going to tailor it to you. Like we're going to tailor to what your running plan is and what your like ailments are coming in. And we're going to treat you as who you are and create that best plan for you. Because I know I've been there. That goal is like everything you work for. And our goal is to get you across that finish line any way we can.
Yeah. And talk about the Alter G technology too, and kind of how that can help with marathoners.
The Ultra G is great. Definitely if you're struggling to get your miles in, because either you're having pain, discomfort, like you're cramping up, the Ultra G is great because we can drop your body weight percentage and still get those miles in. Like you're still getting the time on your feet, getting the miles in, but it's not that same pounding that you may experience on a regular treadmill or out on the road even. It just allows you to keep going. So if we do have to back off a little bit of your running outside of PT, we can get you on the Ultra G so you can keep your miles going and you can keep running.
Yeah, it's a cool technology.
Yeah.
We're fortunate to have it. And what's cool too is it's got like a video feature where you can actually see what your feet are doing
Yeah.
when you're running. So that's pretty cool.
Yeah. And even too, it can show you like if someone's shifting their weight. So, and it can give feedback to the runners too, because sometimes you might not even notice it. But when you see that visual feedback of like, oh, I have like 60% on my left side, like that's definitely why my left side might hurt a little bit more. Or my calf's injured on that side. So it's like a great feedback tool as well.
Yeah, yeah, that's cool. Um, what else? Anything else you wanted to, touch base on about runners before we kind of wrap this thing up?
I think the biggest thing that I've learned over the last 2 years is like listen to your body. Like your body, like when something doesn't feel right, like listen to that and seek out PT because it definitely can help. But every running plan is tailored to yourself, and you just have to figure out like what's best for you. And PTs are here to help along the way.
Yeah, and I think one of the biggest things that most, it's a question that I get from friends and family is like, do I need a script from my doctor? Do I need to go see my doctor first before I come see you? And what I always say is just like call our office, let us, deal with that for you. So if you do need something like that, our office will let you know, but just call us direct and, we'll kind of give you the guidelines. And that's part of the reason why we're called concierge is to, offer that concierge level of service. And at the end of the day, we're here to try to, really to make you better, right? And to, make sure that people are hitting their goals and both performance and, pain, right?
Yes,
So thanks again, Marissa, for joining me
of
today.
course.
And hope this is helpful for any of those runners out there. And yeah, awesome. Thank you.